I'm Dr. Freund Maravankin, and I work at Northeast Georgia Physicians Group Internal Medicine in Gainesville. So I've always been a science kid, like ever since I was in lower school, middle school, I've always loved science. I had an awesome opportunity to dissect multiple animals in my early science classes, like 6th grade and onwards, and I really liked the anatomy part of things, and that's kind of what brought me into medicine. Eventually I realized it wasn't the animal and the anatomy dissection part, but more so the I want to help people part and use science to do that, and somehow ended up in medicine and haven't looked back ever since. There was never a plan B. I did my residency training here at Northeast Georgia Medical Center, and the reason I came here and I liked it here was initially I was wanting to stay in the Southeast because this is what I was familiar with. I have some family in Florida and I wanted to be close to them. I knew Georgia just from having come to summer camp when I was younger. This area meant something to me. I have a lot of childhood friends who live in Georgia, and so this made perfect sense. What I love the most about primary care, and I think what really drew me to it from a very early age, is just I love the relationships that you can build with people and the rapport that you can have with people. Specifically, I trained in family medicine, and so there's the whole like cradle to grave concept, and I've loved being able to see patients from a very early age and follow them through life and get to know all of their family members and kind of have that rapport with everybody, see them through the toughest parts of their life, the happiest parts of their life, and just be able to help and be there as like a catch-all part of medicine. It's a privilege. It's a beautiful thing. So I grew up in a multicultural household where multiple languages were spoken, but primarily English and Spanish. English was my second language, so primarily I spoke Spanish when I was a younger kid, and eventually I learned English more formally in school. I also love the patient population that I found here. I was not expecting to find as many Spanish-speaking patients here, and I feel that I can very much make a difference and connect with them. So when I'm not wearing a white coat and not at work, I do enjoy cooking. I actually love trying new recipes and experimenting with different things in the kitchen. And I like being outside. I like spending time with my dog. We go on nature hikes and trails all the time, which is super relaxing.